السلام عليكم. معكم دكتورة رباب البهيدي، أستاذ طب الأطفال. Today we will talk about joint examination. First, we must differentiate between arthralgia and arthritis. Arthralgia is just pain in the joint without any abnormality of the joint on examination. While arthritis, it may be only swelling of the joint, or two or more of the following: limitation of range of motion, or tenderness or pain on motion, or increased temperature or erythema of the joint itself. So, arthralgia is not arthritis. Arthralgia is just pain, while arthritis either swelling or two or four symptoms. To diagnose childhood arthritis, we must review all the symptoms, either local symptom of the joint or systemic symptom of all the body, and thorough physical examination must be done. General and local examination of each system, and X-ray is ordered for the joint, and laboratory tests are ordered according to my provisional diagnosis based on symptom review and physical examination. The child come with arthritis came with complaint, either joint stiffness, especially in the morning. The child cannot get up from the bed except after 30-minute duration of joint stiffness, and to be considered positive, the duration of stiffness must exceed 30-minute duration. Or complain of swelling of the joint, or tenderness, or pain in the joint up to limitation of the movement. Or the child may complain of limping, especially in young children. Approach to diagnosis. At first, I must define the onset of arthritis, which may be acute or chronic. Acute arthritis, the duration of pain or duration of swelling or duration of a diagnosis of arthritis is less than 6 weeks in duration, as in case of septic arthritis or rheumatic arthritis due to rheumatic fever. While chronic arthritis, the duration of arthritis must exceed 6 weeks in duration, and this as in case of JRA, which is juvenile rheumatoid arthritis. And also I must define the number of joints involved, either monoarthritis, which means only one joint is affected, oligoarthritis, 2, 3, up to 4 joints are affected, polyarthritis, 5 or more joints are affected. And also type of joints must be defined: small joints or large joints. Small joints are joints of the hand and feet, which small joints are affected in disease like juvenile rheumatoid arthritis. Large joint as wrist, elbow, ankle, knee joint, which are affected in rheumatic fever or hematologic disease, but it also can affected in juvenile rheumatoid arthritis. And we must review associated systemic feature. I must ask about fever, skin manifestation in the form of rash, ecchymosis, purpura, ulceration, cardiac examination, renal and lymph node enlargement. Precipitating factor and some important clue. Inflamed infected joint assume a characteristic posture as in septic arthritis, while wasting of a muscle occur in chronic joint involvement. Inspection of joint. or joint examination, I must look, feel, and move the joint. Look at the joint, which is inspection, feel the joint, which is the palpation of the joint, and move the joint. When I inspect joint, I must inspect the joint in sitting and standing position. On standing position, I must inspect the joint from the front of the child and from the back of the child and from the lateral side. In sitting or lying position, I must examine the joint in a prone position and supine position. On looking at the joint or inspection the joint, I look at swelling of the joint or guarding of the joint or redness or muscle bulk or symmetry on both sides or overlying skin manifestation. I must look at all of these points. Swelling of the joint. In case of knee joint, I see fullness of parapatellar groove. In case of ankle joint, the fullness of paratibial groove. In wrist joint, swelling of the dorsum of the wrist joint. In elbow joint, by loss of the prominence of the back of flexed joint. Guarding, I notice that the child is avoiding moving his or her joint or limb or holding it by his or her hand. Redness, muscle bulk, by comparing the muscle in each side. When I see difference in the muscle bulk, I confirm by palpation, which mean measuring of the thigh circumference at the same point above the knee joint in both sides. Symmetry on both sides and overlying skin manifestation as ecchymosis or erythema. Feel or palpation of the joint. By the dorsum of my hand, I can feel hotness or increased temperature of the joint. And by the tip of my fingers, and I can do light palpation on the joint, especially at the point of ligament attachment, to detect there is tenderness or not, or to detect there is crepitus or not. Crepitus is a sound of clicking on light palpation of the joint, and this occurs in case of joint inflammation or degeneration. And by palpation, I can detect swelling. Swelling of the joint, either hard due to bony swelling or soft, suggests synovitis, or may be fluctuant, as in case of presence of fluid in the joint, which is called joint effusion. How can you examine effusion of the knee joint? First, by inspection to detect swelling, I see fullness of parapatellar tendon, especially during flexion. By palpation, I can do bulge sign or sweep test, especially in small effusion. Bulge sign is done by sliding the lateral aspect of the joint by my hand from upward downward, and looking at the medial side of the joint, I notice bulging on the medial side of the joint. This is called positive bulge sign. Or I can do patellar tap. Patellar tap is the test for large effusion. I slide effusion by my hand, as in the photo, by my four fingers and thumb, sliding effusion upward, downward, toward, from the side towards the upper end of the patella for 2 to 3 times and fix my hand, and by the other hand by the index and finger and push on the patella. When I feel bounce, it is a positive patellar tap for large effusion. Palpation is a palpatory technique for detecting or examining a floating object in the body. After palpation is done and I can move the joint. Movement of the joint is divided into either active and passive movement. Active movement is done by the child and passive movement is done by the doctor. The movement of the joint I examine either flexion or extension of the knee joint. Neck examination. On examining the neck, I look for a short neck, which is seen in syndromes like Turner syndrome, Hurler syndrome, Marcus syndrome. And this Turner syndrome is a genetic disorder of female which lack one of the X chromosome. Hurler syndrome and Marcus syndrome are part of mucopolysaccharide syndrome, which is due to accumulation of mucopolysaccharide in the cells, leading to Hurler or Marcus-like feature. I must look at torticollis, which is lateral bending of the neck, of the head on the side of the neck, which may be due to presence of the mass in the neck or may be due to spasm of muscle or fibrosis of muscle. Stiffness or neck rigidity. Neck rigidity, which is immobile neck or difficulty in movement of the neck during flexion or extension, which is seen in cases of meningitis, tetanus, retropharyngeal abscess, acute poliomyelitis. Look for any swelling in the neck or mass in the neck, as in case of cervical lymph node, thyroid swelling, thyroglossal cyst, brachial cyst. And when there is a mass in the neck, I must comment on the site by measuring the length and the width of the mass. The site of the mass present in the left or lateral side of the neck, up or down of the neck. الشيب, السيرفس, السكين over, affected or not, الconsistency, soft or hard, الtenderness, painful or not, الmobility, the mass is mobile or not, pulsation, there is pulsation overlying the mass or not, and temperature. Then look for prominence of neck vein. And lastly, look for visible pulsation on the carotid artery, which is called the corrugation sign. Now, at the end of the lecture, thank you.